Hi there, everyone. My name is Dr. Andrea Shanowski, and I am a chiropractor as well as a holistic healthcare practitioner in Peoria, Illinois. My office is called Freedom Chiropractic and Holistic Health. And today I'm really excited because this Wellness Wednesday, we're going to talk about an integrative approach to TMJ or TMD or temporomandibular joint or jaw disorder. Basically, if you were having any popping, clicking, grinding, pain, or any issues with your jaw, either not moving properly, making sounds, or sometimes even locking up, this is all for you today. So we're going to talk a little bit more about things that you can be doing, as well as some alternative treatment options you may never have been told about or know are out there. So what I'm going to do before we get started is I'm going to go ahead and share my screen. So let me go ahead and pull this up here. We're going to talk a little bit more about that integrative care approach to TMJ pain and dysfunction. So sometimes what happens is we may have a jaw not working properly, or it may be a combination of things. So we're going to talk about all of that today. But I think it's really important to understand, number one, how your body works, how it heals, and if there is a problem, what you can be doing to really take control of your health. So we're going to talk about that today. So to start with, we're going to talk about some symptoms. So if you have TMJ or TMD, as it's more likely called now, typically some symptoms you may have are things like popping, clicking, or grinding in your jaw when it moves or after it stopped moving. Most of the time, most commonly, I see when people are opening their jaw all the way, that we're going to hear that popping, clicking, or grinding pain. And sometimes it's while you're opening the jaw as well. We can also get symptoms of not only jaw pain, but tooth pain as well, because if your jaw is not cracking properly or it's out of alignment, you can actually put pressure on the teeth that can cause tooth pain. And even sometimes I've seen some patients that have had some experience where they're actually teeth cracked from that extra pressure. We can also have some locking up of the jaw where it sticks in a position and doesn't want to move properly. We can also have reduced range of motion. So if you're not able to open or close the jaw or move it like you were before, there may be some issues going on where that jaw is not tracking or moving properly, and that can cause some range of motion issues. We can also see some difficulty chewing. If it is painful to chew on one side, you may switch and start chewing on the other side, but we can also see where the jaw can become weak due to some of that degeneration or issue in the jaw. We can also see some difficulty with talking and smiling. We can also see ear pain as well as ringing in the ears when there's jaw issues going on. We can also see problems with numbness or even aching in the face or around the cheek area. These muscles in your cheek actually help control the jaw. We can even see tension here on the side of the head, like right at your temple area. That can also lead to issues there. So those muscles that control the jaw and attach in a number of different places. So we can see facial numbness, aching. We can also see sinus pressure and pain, because if the jaw is not moving properly, it's going to restrict sinus drainage, and that can lead to chronic sinus infections. We can see ear infections along with that, and of course sinus backup, which can definitely lead to sinus pain and even sometimes infection. And headaches are another big one I see. So when the jaw is not moving properly and those muscles are being overworked, they can tense up and cause pain in this general area right here. I've also seen some issues in the upper neck, kind of behind the jaw as well. And then we can also get, if the jaw's not moving properly, usually we have to overwork muscles in our neck and shoulder area. So we can even see neck and shoulder pain coming from the jaw. I know I have a lot of patients coming in my office that are having neck pain and headaches and aren't even realizing that the jaw is playing a part with that. So in my office, a lot of times we do a full assessment to figure out, is it neck? Is it upper thoracic spine? Is it shoulder? Is it jaw? Is it all of the above? Some of the above. And then we come up with a plan to make sure we address all of those issues and get the balance out so we don't keep having that same problem. So our agenda today, we're going to talk a little bit more about anatomy and the causes of TMJ and TMD, so that you know, number one, how your joint works and moves, or how it's supposed to work and move. And then if you are having jaw pain, some things that could be contributing or things that you didn't know could be causing some of this pain to get worse. We're going to talk about some traditional treatment options and some of the drawbacks with those, especially if you're only doing one or two. And sometimes that multifaceted approach and integrative care can be a really great option for you. So let's start with the anatomy. So I've got some pictures here of basically the skull with muscles overlying it. So if you look at that picture on the screen, you can see that we have muscles not only in the neck, you have 4 layers of muscle in your neck and upper back. So each and every single layer helps hold the head up, helps to turn it, move it around. We also have layers in our face that actually help to move the jaw, as well as helping to assist with chewing motions. And then I also have a picture, kind of an internal view of the jaw. If we cut away some of those muscles, you have muscles on the inside of your jaw that help that jaw to shift. Basically, your lower jaw has to shift forward, and that forward motion is controlled by those two muscles that are internal in your cheek. So sometimes we may have to address not only the muscles in the neck and the muscles on the sides of the skull, but sometimes even some of the muscles on the inside of our mouth or the inside of our jaw that are helping with motion there too. If we look at the bony structure, so you have basically 7 vertebrae in your neck, and then you also have your skull, which is made up of multiple bones that come together with a small piece of cartilage in between. Now, as we age, that cartilage space does get smaller. However, it does not fully fuse. So there's still going to be motion and mobility at those joints. Typically in children and teenagers, those spaces are a bit larger. So a lot of times the bones of the skull can shift more. In kids, I've also seen some children that have behavioral disorders will have some overlapping of those bones, or even toddlers that had a difficult birth or have had some trauma sometimes can have some overlapping of those structures. And when those bones aren't moving properly, it causes the muscles to tense up, which in turn can cause the jaw not to move properly. So typically I look at not only the muscles in the skull and around the jaw, I also look at some of the muscles in the neck. I look at the cranial bones, the facial bones, and then also the bones in the neck and upper back to make sure that all of those are working properly. And if they're not, we've got to come up with a plan on how to get that working how it should be so your body can heal itself. If we look at the jaw, so the jaw actually opens. We have, if you see in this picture, there is a little yellow disc. Now you're going to see in this picture that the jaw moves. So I'm going to show you what actually happens when you're opening and closing your jaw. So that little yellow piece there, if you look kind of at the top, I kind of point here with my cursor. So this little yellow piece here is actually a disc. So you have a little bit of cartilage disc that actually is between the bone, the very top of the jaw here, and also the top of the skull. Now, sometimes if we do have some issues with the cranial bones, this may be shaped different and the jaw doesn't sit there properly. But normally when all these muscles and ligaments here are working properly, that jaw sits up in that little groove. And then as you open the jaw, it has to actually glide down and slide across that yellow disc and that bone prominence. So if we're having any issues with how that's moving, it may be a muscle issue. It may be an alignment issue of the bones. It may be damage to the ligaments or even damage to that cartilage disc in the jaw. There's a lot of different possibilities when we're having a jaw not move properly. If we look kind of at a zoomed in view, the other thing to take in mind, which I know I mentioned ear pain already, you can see in this picture here, so that jaw sits up in that little groove. You've got that disc that cushions between it and the ligaments that are actually attached to that disc. The ear canal is right here. So if that jaw is, say, for example, the muscles in the lower jaw aren't moving properly or are tight, they can pull this jaw joint back into the ear canal, and that can cause some issues with drainage from the ear that can lead to ear infections as well as ear pain. Now, when the jaw opens, as that jaw moves down and slides forward across that disc, you have muscles pulling forward and ligaments kind of anchoring that backwards. If we have any damage to the ligament, tearing or degeneration or micro tears or repetitive trauma, sometimes this jaw moves forward more than it should. It can actually start to wear and tear on the disc. So again, when we look at that opening and closing of the jaw, you can see that that moves forward. So it's kind of interesting when you're looking at how that jaw moves, that a lot of different structures are working together to make sure you have perfect motion. If any one of those is off balance, that can cause or lead to injury. So we're going to talk about some of the causes. So we can see jaw injuries, which we'll talk about a little bit more in detail, some of the things I've seen in my office. We can also have myofascial, so that's going to be muscle as well as ligament related, so soft tissue related. And that can be coming from a muscle imbalance. It can come from spine and bone issues and alignment. And it can also come from tracking issues where the jaw itself, when you open it, is not going straight up and down, but it could be shearing or moving off to one side. And that is a tracking issue. And we can also see arthritis. Now we can see arthritis in the neck that's actually is getting nerve pressure that's not allowing the muscles to work properly. We can also see some arthritis in the jaw itself. So let's talk a little bit more about jaw injury. So we can actually get where we get bruxism, or basically grinding of the teeth. That can be related to stress. So sometimes when we're stressed, we clench and grind our teeth, and sometimes we can even clench or grind in our sleep. We can also see gum chewing sometimes for some people, especially if you're chewing your gum always on one side or chewing food always on one side. That can cause those muscles on that side to be stronger. And a lot of times when you're opening, if they're stronger on one side, things are typically going to open faster on the stronger side, so it can start causing that jaw to shift sideways. And we can also see jaw dislocation from traumas like punching or any type of trauma to the face. So car accidents, sports injuries, even falls down the stairs and things like that when you're kids. I've seen a lot of different issues. I actually had a patient who had undergone some anesthesia for a procedure, and her jaw actually dislocated while she was under anesthesia, and they weren't able to relocate the jaw, so they ended up having to put her under again to manually force that jaw back into position. So I've seen a lot of different injuries, not always from trauma, but sometimes other things that are going on in our life. We can also see some of the myofascial related. So if we look at this picture of this woman here, if we draw some lines kind of across, we can see that one of her ears is higher than the other. We can also see one of her shoulders is higher than the other, and her jaw is kind of twisted to the side. So if you look, you can see that her ear is lower on the one side, her jaw's kind of shifted off to the side, and then her shoulders are on level. That is an indicator that we may have some muscles and ligaments that aren't allowing things to move properly. Sometimes that's an issue with the cranial bones where they're shifted or lower on one side. Sometimes it's an issue with how the jaw is moving or the muscles are imbalanced. And then we can also see even some issues. I mentioned spinal issues. Scoliosis or curvatures in the spine can also contribute because they're going to make muscles stronger. Typically, when you have a curvature, you're going to have muscles that are stronger on the side of the curve and weaker on the other side. So in our office, a lot of times we focus on physical therapy and muscle balancing. So we would focus on getting mobility in the joints. We would focus on strengthening these muscles so they can balance out, and we're not getting a lot of compression in the spine. Because when we see these curvatures, you can see that causes the shoulders to be unlevel. So sometimes we have to look at the whole entire spine and the facial bones and the cranial bones to make sure everything is on the same page. Other things to think about when we look at myofascial or soft tissue related, I mentioned improper mandibular tracking. This is kind of a scary picture, but if you can see, his jaw is definitely way off to the side, and you can see that his teeth are really not straight. So sometimes when we look at teeth that are off balance on the top, that could be coming from the skull itself being shifted. Sometimes, since your lower jaw is really only held in place by muscle and ligaments, those muscle and ligaments, if they're off balance, will cause that to shift off to the side. And arthritis. So I mentioned arthritis before in the jaw itself. So like we talked about when we looked at that picture, we have that nice disc in between there, help cushioning. If we start to get damage of the disc where it starts getting worn down, we can see where the actual bone itself becomes rougher, because when we have repetitive trauma, your bone enlarges. But we can also see the disc can wear down and even break in half or become smaller than it's supposed to, and then it's not cushioning that joint properly. So like I mentioned, that jaw is supposed to move, but if we have that degeneration, it is going to pop out of place. It's going to make all sorts of cracking and grinding sounds if it's not moving properly. So when it comes to treatment options, there are a lot of traditional treatment options, and depending on what kind of specialist you go to, they may have different things that they'll recommend for you. So a lot of times when it comes to jaw issues, we'll start with home treatment. So a lot of times you may be told to use ice or heat over the muscles. You may be recommended to do some massage or some stretching for the jaw to help with things. Those are great, but if the jaw itself is out of place or if the muscles aren't working, sometimes we need a little bit more involved care. So mouth guards are available. They do have different styles. So there are actual mouth guards that fit between your teeth. So basically where you would bite down on the surface. There are also some custom mouth guards that can be purchased over the counter. Like there's some that are basically made of like a silicone rubber that you can get at Walgreens or even a sporting goods store. Some of them I do find are a bit long, so they hang off and they can gag you. So I'm not a big fan of those. There are also some that are a little bit thinner that you can actually put in boiling water and then actually cleanse in your teeth, and they're supposed to help fit to your teeth a little bit more. I tend to see the same problem where they're too long and they can cause some gagging issues. So one of the ones that I typically recommend, your dentist a lot of times will be able to take a mold of your teeth and even a mold of your bite and send it off to a company to make a mouth guard. Now they do have some that fit over just the top teeth, which is my favorite by far because it still allows for training and muscle balancing of that lower jaw. Since your upper jaw is fixed, the lower jaw can move because it's suspended by muscles and ligaments. So I like the ones that go over the top teeth. However, we do have some local TMJ specialists that also have some more involved bracing that actually have a cover that goes over your top and lower teeth, and they actually have a device where you can adjust it on the side. So they actually will basically hold the jaw together in the right position, and they'll actually have an appliance that gets adjusted to hold the teeth in the proper position. So if you have a lot of damage, that can be really helpful to get some stability in the joints as we work through some of the other treatment options that are available. Medications are another option. A lot of times if we have a lot of inflammation and pain, your doctor may recommend some things over the counter to help with that. Typically, I do recommend some anti-inflammatories. If you're not a fan of some of the over-the-counter ones that tend to cause liver and kidney damage, I do recommend quercetin. It's a natural anti-inflammatory. It actually stops your body from releasing inflammatory chemicals. So that can be really helpful, in addition to magnesium, which is a natural muscle relaxant to keep those muscles nice and loose. I know some patients have undergone some injections where they'll actually do injections in the jaw itself or in the musculature surrounding that area to help with pain. And then surgery is another option a lot of times that is recommended for patients. And we'll talk a little bit more about those just in detail. I think a lot of people don't realize what options are out there or what they all mean. So usually I'm not a big fan of medications and surgery unless we really have exhausted all other options first and done as much as we can to get stability without those things. But in some cases, if we can't get stability, that may be 100% necessary. So some of the most common surgical options we see for the jaw is something called arthrocentesis. This is basically where they flush out the joint with saline to basically clean up any gunk that's in that joint space. Arthroscopy is when they actually scope and visualize and see what's going on in the joint. Arthroplasty is when they actually go in and basically resurface, so they will remove any adhesions or bone spurs that are formed. If the disc is damaged, they can actually suture it back up to the ligament or sometimes even replace it with a different material to help kind of ensure that you're getting that almost like a joint rebuild. And then joint replacement is another option, and they can use a prosthesis for this. I don't typically see that one used very often. Usually they'll do the first three. That joint replacement is something they don't typically do very often at all. So the problem is a lot of times with these, again, if we have a muscle imbalance or a bone imbalance where the joints aren't moving properly and we do these surgical procedures, they may provide some temporary relief, but if we don't retrain the biomechanics, we're going to end up with the same problem even after they've done surgery or any of these flushing or kind of moving things around. So really important to understand what's going on and try to address all of your issues so that when you do, or if you have to do a surgical option, you get great results on the other side of that. So I'm going to talk a little bit more about integrative care approach, because I think this is really important to understand what other options are out there. So I do, number one, we want to talk about what's causing the factors for you. So if you tend to grind your teeth, we definitely need to make sure we have a night splint in so that you're not grinding and causing things to misalign or cracking your teeth or things like that. If we're chewing all on one side, we need to make sure that we're kind of balancing that out a little bit more so the muscles aren't stronger on one side. Physical rehab, I think, is super, super, super important. You have to retrain the joint motion, you have to retrain the ligaments, you have to train the muscles. All of those have a muscle memory and like to move in the same way that they're used to. But if we need to retrain that, it does take usually 6 to 8 weeks minimum to retrain muscles and ligaments. So I usually recommend while you're doing that physical rehab, you want to have some type of splint or appliance to help make sure that we have that lower jaw able to float there rather than clenching and unaligning it every time you clench your teeth. So that may be something that you can talk to your dentist about, or even look at an over-the-counter device if you can find one that works for you. In addition with that, chiropractic can be really helpful. There are many different styles of chiropractic adjusting for the jaw. I do a combination of drop adjusting, so I'm using less than 3 pounds of pressure. The table moves so we can realign the joint. Sometimes I'll use activator, which is like a little baby pogo stick to put pressure on the joints to try to realign it. And then I also do soft tissue adjusting as well to try to help loosen up and rebalance that jaw. In addition to that, I also offer therapeutic massage. So I have some patients that we will actually do massage over the cranial bones, the neck, the shoulders to loosen everything up. In some cases, if we have scar tissue or adhesions inside of the muscles and ligaments, I may need to even do massage over those muscles to help get that jaw moving properly and making sure those ligaments and muscles aren't interfering with that. And then the biggest and most important thing is neuromuscular retraining. So we need to re-educate and retrain the muscles and ligaments how to move properly. Sometimes that's a matter of getting the joint moving and then teaching the muscles how to work together, loosening them up, and then strengthening them so they know what they need to do to keep that stable for you. So minimizing causative factors, I already talked about some of the issues, but stress relief techniques are really important, making sure that we have a handle on our stress so that we're not grinding our teeth or clenching our jaw to cause issues. activities of daily living modification. So I mentioned chewing already. Mouth guards can be really helpful. And if we do have issues, if you've had braces in the past, sometimes when those teeth shift, they don't quite hit properly, and that can cause some hot spots where you're clenching and actually causing muscles to be tighter on one side. So we can also work with your dentist on occlusal resurfacing as well. And I mentioned chiropractic care. So like I said, there's many different techniques that I use. So I do gentle chiropractic care, no rotation, no twisting style of adjustment, soft tissue work, activator. I also do some scar tissue release with massage, as well as education and retraining those muscles, what they need to do to actually move properly and work together properly. So if you need some help or want to find out more how we can help you or work with your dentist to help you get further with your care, we do provide cost-effective treatment options. So because we offer office visits, chiropractic care, physical therapy, massage, a lot of those can be billed to insurance, or if you don't have insurance, we do have payment options available so that we can help you with getting the care you need and getting you back to where you need to be, and we'll work with you on the finances there. We also offer minimum invasive treatments with no side effects. So typically when we do surgeries and medications, those do tend to have side effects. So we're doing very conservative care in the office to try to get things balanced out to avoid medications and surgeries and more intensive care. A lot of times too, because we're working with you on a gradual basis and we do give homework exercises, you've got to be willing to do the homework. We are going to help make sure that you're getting less time away from your family and work, because not only do we get you in quick in our office and get you taken care of, we don't make you wait around in the waiting room for forever. We also want to make sure that you are working on things at home. So you're not having to come in the office multiple times in a week to get treatment options. We're going to check in the office, give you homework, and it's up to you to do the work outside of our office. And then of course, the biggest thing is we do more of a preventative approach. So if you're starting to have jaw issues, we can get on top of that now, discover the cause, and put together a plan about what you need to do. And in the meantime, we have a very professional approach. We're able to talk with you, explain what's going on, explain what to expect, and then we also can work with your dentist or doctor to make sure that we're all on the same page to help you get better fast. So if you wanted to go on our website, you can request a consultation on our website. We have a new patients tab where you can request an appointment. It's freedompeoria.org is our website. And then also I do have a research handout. If you would like some of that, if you want a copy of that research handout, just shoot me an email, freedomchh@gmail.com, and just say that you want a copy of that TMJ research handout, and I can go ahead and send that. Have a great rest of your day. Hopefully you learned something today. I really appreciate you turning in, and I know that every Wellness Wednesday, we have new videos about health topics to make sure you understand how your body works, how it heals, how it functions, and what you can do to get yourself better faster. So make sure you tune in next week for a new video. Remember, we go live at 5 every Wellness Wednesday with a new video. So have a great rest of your day, and keep on going with your health.